Hi, good evening. My name is Shurma and I am a psych nurse practitioner. And this is Corinne Palmer, my lovely, wonderful clinical preceptor. It is an honor to work with under the guidance of Corinne because she's so highly skilled and knowledgeable in her field of practice. It is indeed a great pleasure to have her as my clinical preceptor here at Kaiser Permanente Behavioral Health Department in Atlanta, Georgia. The type of patients that I am seeing at this phase of my clinical rotation are adults, geriatrics, and pediatric patients here at one of Kaiser's Permanente privately owned ambulatory clinics in Georgia. There are various activities in which I am currently engaged. Under Corinne's supervision, I am seeing patients for psychiatric intake assessments and for medication management and follow-up. I am also doing phone appointments for medication follow-ups and checking on patients to see if their medications are working. In addition, I am doing video visits appointments for those patients who cannot make it into the office. Further, I am leading intensive outpatient groups and assisting with individual therapy sessions for pediatric and adult patients, as well as observing providers in sessions. Approximately 2 weeks ago, I participated in treatment team and presented a case at that session. I am really learning a whole lot in my clinical rotation. I am learning to identify signs and symptoms related to the different mental health disorders firsthand. I am also learning to ask appropriate questions to arrive at the correct diagnosis and to justify the diagnosis that I am given. My knowledge base has expanded greatly during this clinical rotation. I am finally connecting the dots and getting all the experience that I need in one location to increase my competency and diagnostic skills. There are 2 areas of focus for my second semester. The first one is I really want to build upon my assessment skills and be able to identify prominent signs and symptoms related to diagnosis as written in the DSM-5. Secondly, I want to increase my knowledge base in reference to psychopharmacology that are utilized to treat mental health disorders. Further, I want to clarify and clearly understand, the rationales for prescribing particular medications and clearly explain to patients how medications work to relieve their symptoms and help them to feel better. Overall, I am having a great learning experience in my clinical rotation. Thank you. And here is my lovely preceptor, Corinne Palmer.
Hello, good afternoon. So, my duty at this time is to let you know how I feel that Shurma is progressing this semester. I think she's really catching on very quickly, actually. She's doing the evaluations. She's done a couple of them completely on her own as well, and she's getting in touch with, the flow of how she should be asking questions, and she's getting more comfortable talking to patients. She's not feeling as anxious or apprehensive about it. She's getting the idea of clustering her diagnostics in terms of, putting all the anxiety patient symptoms together along with their depression symptoms together, and being able to identify that this might be more than just anxiety or more than just depression, but perhaps a mood disorder such as bipolar or psychosis disorder as well. So she's doing really well in that, learning her diagnostic skills, learning how to justify them based on the symptoms, as she said earlier, she's really doing that pretty well. There's a question here that asks if I have any concerns regarding the student or communication with the university or the precepting in general. I don't have any concerns about Shurma. I think that she's doing a great job learning. If she isn't sure about something or she doesn't know something, she asks about that. So she doesn't, she's not kind of like, okay, I got this kind of thing. She's, she'll check things out and ask questions about it. And even when we discuss it, if she's not exactly sure why we're doing something the way we're doing it, she, wants to understand the rationale behind it. So those are all good things. I would agree with Shurma in that the areas that she needs to focus on is the medication, like what to prescribe for what diagnosis and how to be able to identify which drug you should choose. Example, there's a lot of SSRIs that are used to treat anxiety and depression, but how do you choose one from another? What makes that difference into why you would, choose Lexapro versus choosing Prozac. So I think that's important for her to learn, and she's already asking those kind of questions when we prescribe something or if somebody comes in for follow-up. She's like, now why did you choose that medication? And she's asking all the right questions, which is really good. And then, of course, continuing to work on her psychiatric evaluations, and her follow-up with medication management patients that are just here for follow-up to kind of get their prescription renewed and that sort of thing. I think those areas are, very, very much areas that you need to have a lot of experience with before you get out there on your own. So getting as much of that as she can get, I think will be, very valuable for her to increase her skills. That's really about all I have.
Right,
she's lovely to work with.
And she's as well. Let me show a little bit about around the room. So this is Corinne Palmer's office. And this is all her certificates, her license. Okay. It's nicely decorated. Makes you feel homely. Okay. Thank you very much.
Goodbye now.